Good morning, students. I think one of your colleagues, one of the doctor has asked me, sir, we have some doubts regarding bipolar disorder. Okay, so we have some doubts regarding bipolar disorder. So kindly explain briefly the pharmacotherapy. Treatment you are asking. Okay. See, so the doctor, a colleague is asking about bipolar disorder. Fine. So see, bipolar disorder is something which you should actually read as precise as you can, because chances of getting 2 to 3 MCQs is very high. Bipolar disorders, fan favorite, and I am also very good fan of bipolar disorder. Without making any delay, we'll just get into the topic. So what are bipolar disorders? There are actually two types of bipolar disorder. This type 1 and type 2. This is very important first statement. Just remember. So what is type 1? Type 1 is something which has episodes of mania with or without depression, right? With or without hypomania episodes. So type 1 is something, the condition, the type 1 bipolar disorder, we observe mania with or without depression, with or without hypomania. But if in case of type 2, you have exclusive hypomania. Remember, hypomania is seen in type 2 with depression. Very, very important. Okay. Now, sir, what is the management of bipolar disorder? What is the management? Simple. If it is in case of mania or depression, you always go with something called lithium, right? And if it is a severe form of bipolar disorder, see, for example, if it is a severe form of bipolar disorder, then you go for electroconvulsive therapy in severe disorder, right? You get it? So this is if in case of if the person is suffering with mania or depression. But if you ask me exclusively for mania, sir, what if it is mania? What if it is mania? Then you can go for valproate, right? Or you can go for carbamazepine, right? Or you can go for, see, I am writing with red, it is important, antipsychotic. Can you tell me for which conditions antipsychotics are drug of choice? Antipsychotics are drug of choice for anyone in the room? Acute mania, very, very important. Acute mania, antipsychotics are the drug of choice. Please remember this statement, it is very important. Okay. Now, what about, sir, what about depression? If the patient is having depression, then what medication or what therapy that we should use? If it is having depression, you should go on with lamotrigine, right? Or you can also give antidepressants. Remember, previously we studied one statement, right? We studied some statements, no? So remember those things. Under cover of mood stabilizers, remember, always antidepressants given under cover of mood stabilizers for depression. Remember this statement, very very important. Okay, now what are some antipsychotics? Sir, please tell us some examples regarding antipsychotics. Now first one is, I'll write with red color, quetiapine, and it is the most common antipsychotic used, quetiapine. Okay, followed by lurasidone, it is R, lurasidone, remember lurasidone. And next one is lumateperone. Fourth one is carprozine. Actually cariprazine, right? Cariprazine. And fifth one is olanzapine, very important drug, guys. Remember olanzapine always. Olanzapine you should combine with fluoxetine. Paroxetine should be avoided in, I think we studied somewhere. Please drop it in the comment section. Now if you ask me with these drugs, these are all antipsychotics, with these drugs we already discussed, we should also give mood stabilizers with antidepressants, right? So what are those mood stabilizers? We will discuss now. They are actually given as maintenance drugs. Remember this, they are given as maintenance drugs. Okay, now what are some mood stabilizers? Lithium, followed by lamotrigine. Now lamotrigine, I just want to tell, previously also in previous class also, actually I want to tell this statement but I actually forgot it. Lamotrigine, I will write with different color. Lamotrigine is the safest mood stabilizer, guys. Remember this statement, previously I forgot actually. Stabilizer in pregnancy, just remember this statement, it's very very important. Lamotrigine is the safest mood stabilizer in pregnancy. Okay, remember this. And the next mood stabilizer is valproate. Valproate is a mood stabilizer, also an anti-epileptic agent, right? Next, carbamazepine. Valproate is valproate a teratogenic drug? Yes, it is a teratogenic drug. What does it cause? Can anyone? What does it cause? Please drop it down in the comment section. And what teratogenicity does carbamazepine have? Can anyone tell? What teratogenicity lithium can cause? Please drop it down in the comment section. Comments, please. Okay, I think with that we finished the bipolar disorders treatment. We will come back with one more new topic. Okay, till then, your wise doctor. Thank you.